Hi all, welcome back to my channel. I hope you guys are doing good. Today, I'm going to discuss about colostomy, the different types of colostomy, how do they perform the surgery, the different types of colostomy bags, and how to take care of patient with colostomy. Let's move on to the topic. Before moving on to the topic, let's have a quick glance at the anatomy of colon. As you all know that it is the part of the digestive system and one section of the large intestine. The main role is to process indigestible food materials, that is, the contents which is emptied from the small intestine. It is about 1.5 meters in length and consists of 4 parts. You can see that in the picture. So this is the ascending colon, which is located in the right side, and transverse colon, which is traveling across, and descending colon, which is located in the left side, sigmoid colon, rectum, and anus. Let's talk about colostomy. Colostomy is a surgical procedure that brings one end of the large intestine out through an opening made in the abdominal wall. So the opening is known as stoma. In the picture, you can see this is the large intestine. So one end is brought out through a small opening which is known as stoma in the abdominal wall. A colostomy is done when the lower part of the large intestine, rectum, or anus is unable to function normally or needs rest from normal functions. The main indication are Crohn's disease, diverticulitis, and injury to the colon or rectum, intestinal obstruction, colon cancer, Hirschsprung's disease, partial colectomies where the remaining end of the bowels can be reattached later. And the main indications for permanent colostomy are incurable fecal incontinence, advanced colorectal cancer, or permanent removal of the rectum or anus. Let's talk about the types of colostomy. Based on the location of stoma creation, it's been classified into 4 types: ascending colostomy, transverse colostomy, descending colostomy, and sigmoid colostomy. So in the picture here, the stoma is being created in the ascending colon, which is known as ascending colostomy. In transverse colostomy, the stoma is in the transverse colon. In descending colostomy, the stoma is created in the descending colon, and in sigmoid colostomy, the stoma is created in the sigmoid colon. So, the colostomy may be performed through either laparoscopic surgery or open surgery. So, laparoscopic surgery is a minimally invasive surgery where the surgeon uses laparoscope to perform the surgery. Whereas in open surgery, the incision will be made directly in the abdomen and the surgery will be performed. Let's talk about the surgical methods. There are 2 general types of colostomy operations performed. The first one is loop colostomy and the second one is end colostomy. So in the picture you can see, as the name indicates, in loop ostomy, the large intestine will be brought out through a small opening as a loop, and in end colostomy, it will be totally cut off. Let's discuss about this in detail in the following slides. So let's talk about loop colostomy first. It is temporary where the surgeon pulls a loop of colon through the opening in the abdominal wall. As you can see in the picture, through a small opening, a loop of the colon will be pulled out. Then the loop will be partially severed and the edges are stitched to the skin to form two stomas while they are still connected. In the picture, you can see the loop is partially cut and the edges are stitched to the skin to form two stomas. The upper end, which is connected to the small intestine, is where the poop comes out, and the lower end, which is connected to the lower part of the bowel, excretes the mucus that normally produced there. So finally, it looks like this two stomas while they are still connected. The second one is end colostomy. It is permanent where the upper end of the bowel is brought to the opening in the abdomen. Then it is stitched there to hold it permanently in place. In the picture you can see here the colon is completely cut off and created as a stoma. The other end may be completely removed or left inside as a blind pouch based on the condition of the patient. The next type is double barrel colostomy. Here, the surgeon divides the bowel completely, then each end is brought to the surface of the abdomen as a separate stoma, as you can see in the picture. The next method is Hartmann's procedure. It is the surgical resection of the rectosigmoid colon with the closure of the anorectal stump, creating what is known as Hartmann's pouch and formation of an end colostomy. So in the picture you can see one end is created as a stoma and the other end is stitched and left inside as a blind pouch. Let's have a quick look at different types of stoma. So the first one, this is how an end colostomy looks outside. You can see only one stoma. The second picture is loop colostomy, where you can see two stomas while they are still connected. And the third one is double barrel. Here you can see two stomas outside. Let's discuss about the types of ostomy bags. The ostomy bags are available as one piece and two piece. One piece is very easy to apply. Just open and fix it. It has two types. One piece closed pouch where the end is completely closed. So once the bag is full, you can dispose of. The second is one piece drainable pouch. Here in between you can empty the contents and reuse. The second type is two-piece pouch. So here you have a separate base plate and pouch. This also available as closed pouch and drainable pouch, as you can see in the picture. Here in closed pouch the end is fully closed, and in drainable pouch you can empty the contents in between and reuse. So the ostomy bags are also available in small size, which is known as mini pouch, as you can see in the picture. The first one is one piece closed mini pouch, and the second picture is one piece drainable mini pouch. The mini pouches are available in two piece as well. So the first picture is two-piece closed mini pouch and the second one is two-piece drainable mini pouch. The last one is stoma cap. This is also available as one-piece stoma cap and two-piece stoma cap, as you can see in the picture. These are all ostomy shower caps which can be worn by a person while taking shower to protect the stoma. So let's move on to stoma care. How a healthy stoma looks. It looks like pink or red in color, moist and slightly shiny, as you can see in the picture. There are certain points we need to remember while taking care of colostomy patients. First one is always use the right type and size of base plate and ostomy pouch. So whenever you are applying the base plate, the size is very important. The size should not be too small or too larger than the stoma. The second one is change the pouch system regularly. So according to the instructions, the colostomy pouch needs to be changed properly. The third one is be careful while removing the pouch system away from the skin. Always be gentle to your skin. The fourth one is clean the skin around the stoma with water. Next, look for any allergies. If you find anything, change the brand of the pouch, or if it is severe, kindly seek medical attention. Shave the hair under the pouch for proper attachment. Seek medical advice if there is excessive gas formation, odor, diarrhea, electrolyte imbalance, any obstruction, finding capsule or medications in the pouch if you are on any medication, severe skin problems or allergies, necrosis, retraction and mucocutaneous separation, infection, fistula, stenosis, parastomal hernia, and prolapse. Thank you so much for watching this video. Now I'm sure that you got a clear-cut idea about what is colostomy, the different types of colostomy, how do they perform the surgery, how the stoma looks like, the different types of ostomy bags, and how to take care of it. These are all the basic things a person should know while taking care of a colostomy patient. I hope this would be helpful for you guys. If you feel the same, kindly like, share this to your friends and subscribe my channel. My channel name is Jebin Shine and don't forget to press the bell icon button so that you will get the notifications whenever I am uploading new videos. Thank you all. See you all again with one more interesting topic. Until then, it's bye from Jebin. Bye bye. Take care.